My name is Dr. Jared Louw. I am the veterinarian at the St. Thomas Animal Clinic. The overall image quality for the Clarius is quite excellent, especially compared to our other clinic's older model. It's quite clear. We can change the depth and the grain quite well, and then there's kind of an easy, intuitive way to add the Doppler or to add annotations quite easily. The Clarius has improved it quite a bit because we're able to even do bedside care with those patients that obviously are compliant. I think the clients like it when we're able to show with their cat or their dog in clinic while scanning on the bedside with them kind of the lesions we're worried about or with helping with our diagnosis. And obviously some of the patients that maybe aren't as compliant, I guess you could say, we can bring them back to the back of the clinic in the treatment area and then we can scan there, but I can also take pictures. Pictures are worth $1,000 to clients. They're not paying that much obviously, but to help with the diagnosis goes a long way for sure. Makes it much more efficient, the mobility of it. For abdominal effusion and ascites, that helps us diagnose if it's a hemoabdomen or just transidate or exudate. We use a lot for urinary cases as well, if it's like cystitis or a mass, still like calculi stones and stuff like that. Sometimes we can find the kidneys, we can see enlarged livers. We've been able to diagnose, it's a little bit harder, we've been able to diagnose some type of obstructions as well, like GI obstructions, which helped a lot. I know my colleague in the clinic is a bit more trained for thoracic ultrasound, so you can see like ENT waves, which would be present in respiratory disease, and that helps quite a bit. So I would give it definitely a 10 out of 10 for use and kind of easeability of using the program. Sometimes it's rare, we're not going to never knock it, because there's some software issues sometimes, but the technical support and the support from the reps always help with that stuff, so it still keeps it a 10 out of 10 for recommendation. Probably just pre-investment in training, making sure you're comfortable with ultrasound before you invest in it. There's a steep learning curve, some of those ultrasounds, but there are resources provided when you kind of go with the Clarius team. Things like having troughs available, that's going to help a lot with your scanning. Just because when you do it, you have to be able to understand it so you can explain it to the client. And if you're kind of uncomfortable, then that's just scanning time too. You need to get all that experience, but it's definitely worth the investment.